Good morning, everyone. This is Miss Bats Rodriguez. As you all know, I'm the East Carolina University graduate student, and today we are going to be discussing National Patient Safety Goals and how they are used in nursing practice. After you complete the activities in this module, you will be able to respond to situations safely with awareness of appropriate values, attitudes, and behaviors for the individual and the nursing profession. You will be able to implement safe, therapeutic care with professional, effective communication to individuals with health alterations, and you will be able to perform ethically and safely within the healthcare system according to the Nursing Practice Act, healthcare policy, and the National Patient Safety Goals. To begin this module, you will complete the Dirty Dozen activity located in Blackboard. In the posted picture, there are 12 things that violate proper infection control practices. What are these 12 things, and how can they be corrected? This activity is due by Monday, October 8th at 1700 hours. The answers to the activity will be provided after the due date. Now let's talk more about National Patient Safety Goals. What are they? Who regulates them? And what types of institutions do they impact? The National Patient Safety Goals are evidence-based standards of care used to improve and maintain patient safety. They were established by the Joint Commission's Patient Safety Advisory Group, and they were created in response to the Institute of Medicine's To Err Is Human. To Err Is Human was a publication that brought patient safety issues in the healthcare setting to light. The Joint Commission regulates national patient safety goals and reviews and updates them yearly. The National Patient Safety Goals impact hospitals, home care agencies, behavioral health facilities, long-term care facilities, outpatient surgery centers, and laboratories. We will be looking at National Patient Safety Goals and their relation to the hospital setting. We will first take a look at Goal 1, improving the accuracy of patient identification. You will see that there are two components listed under this goal. The first is to use at least 2 patient identifiers when providing care, treatment, and services. You may ask, what are the acceptable patient identifiers? These identifiers include the patient's name, an assigned identification number such as the account number, the patient's telephone number, or other person-specific identifiers such as date of birth. You will most often hear healthcare providers ask for name and date of birth. Also, be sure to label containers used for blood and other specimens in the presence of the patient. The second component of this goal is to eliminate blood transfusion errors related to patient misidentification. To meet this requirement, a 2-person verification process must be completed before initiating the transfusion. The verification process should be completed by the person who is going to administer the transfusion and a qualified participant. The qualified participant will be determined by the facility's policy. During the verification process, the blood or blood component must be matched to the physician's order, and the patient must be matched to the blood or blood component. This helps reduce the number of transfusion errors. Next, we will look at Goal 2, improving the effectiveness of communication between caregivers. This goal addresses reporting critical results of tests and diagnostic procedures in a timely basis. Critical results are results that fall significantly outside the normal range and may indicate a life-threatening situation. The responsible licensed caregiver, such as a physician, must be notified of these results within an established time frame so that the patient can be promptly treated to prevent poor patient outcomes. Next, we will look at Goal 3, improving the safety of using medications. There are 3 components to this goal. The first is to label all medications, medication containers, and other solutions on and off the sterile field in perioperative and other procedural settings. Labeling includes medication or solution name, strength, amount of medication or solution containing medication, diluent or diluting substance name and volume, expiration date when not used within 24 hours, and expiration time when expiration occurs in less than 24 hours. Medications or other solutions in unlabeled containers are unidentifiable and errors can occur. Sometimes these errors can lead to tragic results. The second component of this goal is to reduce the likelihood of patient harm associated with the use of anticoagulant therapy. With this, patient education is vital. The patient should be educated on the importance of follow-up monitoring, compliance, drug and food interactions, and the potential for adverse drug reactions and interactions. When available, you should only use oral unit dose products in pre-filled syringes. You are going to follow hospital-approved protocols and assess patients' baseline coagulation status. For warfarin, you're going to assess your patient's PT and INR levels, and for heparin, you assess your patient's PTT levels. The third component of this goal is to maintain and communicate accurate patient medication information. This is also known as medication reconciliation. Medication reconciliation is intended to identify and resolve discrepancies. It is a process of comparing the medications a patient is taking with newly ordered medications. The comparison addresses duplications, omissions, and interactions, and the need to continue current medications. You should obtain information on the medications the patient is currently taking when they first are admitted to the hospital. Now let's talk about Goal 6, reducing harm with clinical alarms. This goal addresses improving the safety of clinical alarm systems. Clinical alarms are intended to alert staff of potential patient problems, but they can compromise patient safety if not properly managed. Patient care areas can have numerous alarms leading to desensitization. In 2013, Sindelbach and Funk published an article called Alarm Fatigue. Alarm fatigue is becoming a major problem in healthcare. In 2013, a Sentinel event alert was published by the Joint Commission. A 60-year-old patient died from a delayed response to an alarm, not the condition that caused the patient's hospitalization. Inadequate staff education was also noted to be a contribution. A root cause analysis conducted by Sindelbach and Funk revealed 3 contributing factors to alarm fatigue. Alarms were off or set incorrectly, there were no alarms for certain disconnects, and alarms could not be heard in all areas. In light of this, you should be aware of important alarms in your clinical area and how to properly respond. Next, we have Goal 7, reducing the risk of healthcare-associated infections. There are a total of 5 components under this goal. And per the CDC, millions of people acquire healthcare-associated infections each year. The first component of this goal is to comply with either the current CDC or WHO hand hygiene guidelines. Proper hand hygiene is one of the most important ways to prevent the spread of infection. The second component of this goal is to implement evidence-based practices to prevent healthcare-associated infections due to multi-drug resistant organisms in acute care hospitals. These infections are occurring at an alarming rate. Hand hygiene, contact precautions, as well as cleaning and disinfecting patient care equipment and the patient's environment are essential strategies preventing the spread of healthcare-associated infections. The third component for Goal 7 is to implement evidence-based practice to prevent central line-associated bloodstream infections. To do this, you must be educated and provide education to your patient. Follow facility policies and procedures to reduce the risk of infection. Perform hand hygiene prior to manipulating the central line. Evaluate the central line routinely and remove non-essential catheters. The fourth component of Goal 7 is to implement evidence-based practices for preventing surgical site infections. Become educated about surgical site infections and the importance of prevention. Educate patients and their families about surgical site infections and prevention. Follow facility policies and practices regarding surgical site infection prevention and frequently assess surgical sites. The fifth and final component of Goal 7 is to implement evidence-based practices to prevent indwelling catheter-acquired urinary tract infections. Provide education to your patients and families. Follow facility protocol for limiting the use and duration of the urinary catheter. Perform hand hygiene prior to catheter insertion or maintenance care. Use aseptic techniques for site preparation, equipment, and supplies, and secure catheters for unobstructed urine flow and drainage. Maintain the sterility of the urine collection system and replace the urine collection system when required. Next, we have Goal 15, Identify Inherent Safety Risks. This goal looks at identifying patients that are at risk for suicide. Suicide of a patient while in a staffed, round-the-clock care setting is a frequently reported type of sentinel event. So what can we do about it? We can conduct a risk assessment. It should identify specific patient characteristics and environmental features that may increase or decrease the risk for suicide. We can also address the patient's immediate safety needs. And upon discharge, we should provide suicide prevention information, such as a crisis hotline, to the patient and his or her family. The final goal we are going to discuss is Universal Protocol. The goal of Universal Protocol is to prevent wrong site, wrong person, and wrong procedure. The first component is to conduct a pre-procedure verification process. This is to verify the correct procedure for the correct patient at the correct site. The patient should be involved if possible. The second component is to mark the procedure site. This should be done prior to the procedure with the patient. The site is marked by a licensed independent practitioner who is ultimately accountable for the procedure and will be present when the procedure is performed. The third component is that a timeout is performed before the procedure. This should be completed immediately before starting the procedure. It involves immediate members of the procedure team, and they must agree on the following: correct patient, correct site, and the procedure being performed. This timeout process must be documented. After reviewing the PowerPoint, you will complete the case study and extended stay. It follows Mr. Eugene, a 64-year-old man with a number of health issues that comes to the hospital for difficulty breathing. The care team helps resolve the issue, but forgets a standard treatment that causes unnecessary harm to the patient. A subsequent medication error makes the situation worse, leading to a stay that is much longer than anticipated. The case study is located in Blackboard under Module 7. It is due on October 11th at 1700 hours. Be sure to follow the posted directions. Why are National Patient Safety Goals important? National Patient Safety Goals directly impact nursing care. They provide a guide for safe practice and can help prevent legal issues. They provide a framework to prevent medical errors and address them when they do happen. National Patient Safety Goals must be met in order for hospitals to obtain reimbursement. Addressing these goals helps to lower the rate of injury and infection, which increases the rate of reimbursement. And these goals also must be met to obtain and maintain accreditation through the Joint Commission. If you have any questions about any of the content presented, please do not hesitate to ask. There has been a link posted in Blackboard that allows you to contact me directly with any questions you may have. I will be sure to respond in a timely manner.